Osteoporosis is a type of metabolic skeletal disease where the osteoclastic bone resorption outpaces the osteoclastic bone formation. This causes bone density to decrease and risk of fractures to increase. Generally, osteoporosis is associated with the mechanics of the endocrine system, such as low blood calcium levels, vitamin D deficiencies, estrogen deficiencies, and secondary hyperparathyroidism. A normal human bone consists of approximately 65% mineral salts and 35% organic matter. Hydroxyapatite is a calcium phosphate that makes up the majority of the mineral salts found in human bones. The organic matter is comprised of around 90% type 1 collagen, with the remaining 10% being non-collagenous proteins. The mineral salts provide physical structure and hardness to the bones, while the organic component provides tensile strength and flexibility. These bones are part of the skeletal system, which function is for support, protection, storage of minerals and lipids, blood cell production, and facilitates movement. Bones can come in a variety of types, including long bones like the femur found in your thigh, flat bones like the ones found in your cranium, short bones like the carpals found in your hand, and irregular bones such as vertebrae found in your spine. Calcium homeostasis is a balance and regulation between serum calcium in the blood and mineral calcium in the bones. This homeostatic process involves the thyroid, parathyroid, liver, kidneys, and bones. 99% of calcium is stored within the bones, and when serum calcium in the blood begins to drop, parathyroid hormone is sent to release stored calcium into the blood. In the liver, vitamin D is converted into calciferol, which is then converted into calcitriol, also known as active vitamin D. In the kidneys, this active vitamin D, which regulates the calcium and phosphorus levels in the blood, ensuring a healthy skeletal system. Osteoporosis refers to osteon, bone in ancient Greek, poro, porous in ancient Greek, and osis, meaning condition or state. Putting this together, this describes the disease as a porous state of bone. Bone is a dynamic tissue which constantly undergoes remodeling. When someone is suffering from osteoporosis, their parathyroid gland increases its release of the parathyroid hormone, which in turn works to increase the calcium content in the blood by releasing calcium stores in the bones. In doing this, osteoclasts increase its breakdown of bones faster than the osteoblasts can reform the bone, effectively increasing the porosity of the bone. A bone densitometry test is done to diagnose osteoporosis. It assesses the mineral density of the bone and compares it to someone of a similar demographic. Results are given as a t-score, and generally a score between +1 and -1 are considered normal, healthy bone. A score of -2.5 or lower is categorized as osteoporosis. As seen here, the density of the diseased bone is far less than a healthy bone. According to the Australian Bureau of Statistics, 924,000 Australians have osteoporosis. Osteoporosis starts to affect mainly women over the age of 50 and who are postmenopausal. This drop in estrogen leads to high rates of bone resorption compared to bone formation. While osteoporosis does also affect men, it is much less likely. Other factors which may cause osteoporosis include low vitamin C intake, low vitamin D levels, being over or underweight, lack of weight-bearing physical activity, and an array of medical conditions such as cancers, liver and kidney disease. Treatment for osteoporosis includes bisphosphonates are the most widely prescribed medicine to treat osteoporosis. They slow the bone resorption rate by reducing osteoclast function. This reduction in osteoclast function allows osteoblasts to improve bone density and reduce chance of fracture. Denosumab is a monoclonal antibody that inhibits osteoclast formation, giving osteoblasts a chance to increase bone formation and in turn bone density. It does this by binding to cytokine RANKL. By binding and blocking RANKL, osteoclasts can't mature, function, or survive, reducing bone resorption. Hormone therapy is used to replace estrogen in women whose estrogen levels have dropped after menopause. It is recommended that this treatment is only used on women under 50 or women whose menopause symptoms need treatment. This is due to a heightened risk of developing breast cancer. In less serious cases, weight-bearing exercise such as walking, stair climbing, and jogging can help stimulate bone function.